I am delighted to make a keynote address on the subject ongoing communication and engagement strategies in combating the pandemic. However, before I do so, allow me on behalf of the State Duma, lower house of Russian Parliament, to bring you greetings from the Liberal Democratic Party of Russia and our people. I also thank the organizers for extending the invitation to be part of this very important event. Humankind has never faced so many global challenges as it does today. In addition to legal ones, the COVID-19 pandemic has already become a real global health and economic crisis. Russia was affected by COVID-19 as many other countries and became a part of an ongoing pandemic of this disease. There are many speculations about the origin of that disease. Some sources insist that this virus is a part of some kind of bioweapon. However, all scientific analysis found no evidence that the virus was made in a laboratory or otherwise artificially engineered. It was confirmed that the virus came to Russia on January 31, 2020, with two Chinese citizens visiting Tyumen, Siberia, and Chita, Russian Far East. Both Chineses were tested positive for the virus. As a step to prevent virus spreading, the extensive testing had started and the border with China was closed. From February 2020, all passengers arriving to Moscow by air from COVID-19, most affected countries such as China, Iran, and South Korea were met by a number of medical workers and in protective gear in charge for passengers screening. People who came from Europe before those flights were cancelled had their temperatures taken and were sent home for a mandatory 14 days quarantine. On March 2, 2020, the infection spread from Italy, brought some additional measures such as cancelling mass public events, closing schools, theaters, and museums, as well as shutting the international borders and declaring a non-working period which, after two extensions, lasted until May 11, 2020. By the end of March, the vast majority of regions and cities, including Moscow, had imposed lockdowns. However, by April 17, 2020, COVID cases had been confirmed all over the country. As a transcontinental country, Russia has the highest number of confirmed cases in Europe and the second highest in Asia after India. However, in the world we are after United States, Brazil, and India. We have over 1 million total cases, over 170,000 active cases, around 900,000 recovered, and close to 2,000 deaths. Those figures are quite impressive. However, as per 1,000 population, Russia takes the 40th place by total cases in only the 100th place by the number of deaths. Furthermore, we are the first by number of COVID tests per 1,000 population. Over 38 million coronavirus tests have been done already, and the members of the Liberal Democratic Party of Russia and its member of parliaments are among the most active participants of this campaign. For example, all party headquarters has such tests twice a month. Moscow headquarters was tested yesterday. Our effective strategy to fight the pandemic included the following: strengthening the country's health care system, expansion of intensive care capacities and measures to slow down the infection. A great number of hospitals all over the country got so-called red zone wards to treat COVID-19 patients. On the very short notice, Russian army has established 18 field emergency hospitals to cover remote and most affected areas. Only mass vaccination could stop any pandemic. Therefore, the main Russian research institutes started to work on it from the very beginning. Clinical trials of coronavirus vaccine developed by the Gamaleya Research Institute were officially completed on August 1, 2020, followed by 6 other research institutes. The government of Russia has initially responded to the pandemic with preventive measures to curb the spread of coronavirus disease, which involved imposing quarantines, carrying raids on potential virus carriers, and using facial recognition to impose quarantine measures. Those measures to prevent a crisis in Russia include banning of exports of medical masks, random checks on the Moscow transport system, including Moscow subway, cancellation of large-scale public events. The Russian government has also taken measures to prevent foreign citizens from heavily affected countries from visiting Russia. Regional governments have also responded to the pandemic by imposing their own preventive measures in their local communities. On March 29, 2020, stay-at-home order for all residents was introduced in Moscow. Citizens were not allowed to leave their homes except in cases of emergency medical care and other threats to life and health. Only limited number of people from vital industries were allowed to travel to work. Moscow citizens could make purchases only in the nearest shop or pharmacy, to walk pets at a distance not exceeding 100 meters from the place of residence, as well as to take out this garbage. Socially safe distance of 1.5 meters should be kept between people. The similar self-isolation regime was imposed on Moscow region and many other regions and cities. Such limitations, frankly speaking, were not popular among our population and even caused some social tensions. Thus, testing the identification of cases, tracing contacts, isolating, these are all measures that WHO proposed and recommends, and they were in place all the time, all over in Russia. This disease affected the whole nation with no exception. On April 25, 2 cases of COVID were confirmed in State Duma, the lower chamber of the Federal Assembly, our parliament. On May 13, 2020, the chairman of the State Duma, Vyacheslav Volodin, announced that the 5 deputies have been infected. On May 20, the chairman of the Federal Council, the upper chamber of our parliament, Valentina Matvienko, said that 5 senators had recovered from COVID-19. Thus, over 30 deputies of our parliament in total were affected by coronavirus. The Liberal Democratic Party of Russia and its chairman Vladimir Zhirinovsky were among the first who started active campaign against COVID-19. From the very beginning, on February 19, LDPR chairman demanded that all Duma deputies should strictly comply with the rules of personal hygiene, wear protective masks and gloves, periodically and properly clean hands, maintain safe distance with others. Furthermore, Vladimir Zhirinovsky demanded to stop all handshakes and greeting hugs. As a result, being the first in those protective measures, LDPR Duma deputies have avoided getting sick by COVID-19. It was also decided to minimize the number of deputy assistants in State Duma. The general access to Duma was limited and the majority of deputy assistants had started to work online from home. Due to trips for Duma deputies were cancelled, as well as many public gatherings planned for spring-summer 2020 were postponed, including annual international large-scale forum development of the parliamentarism. The State Duma authorities announced extra sanitization measures, limitations of quantity for parliamentary hearings and roundtables. On April 30, the Minister of Health of the Russian Federation, Mikhail Morozov, came to the State Duma to meet LDPR deputies and the party chairman Vladimir Zhirinovsky. Both sides discussed the joint efforts to contain COVID-19 spreading, how to provide people with low income with regular medical assistance and medicines. Telecommunication has already proved to be the most effective measure to minimize COVID spread. Thus, further emergency telemedicine development was the main topic of the discussion. Talking about preventive measures, LDPR chairman again pointed out the urgent necessity to wear protective masks and gloves in public. When Prime Minister Mikhail Mishustin was in Duma on July 22 with his report on the cabinet recent activities, Vladimir Zhirinovsky drew attention to the fact that the Prime Minister is not wearing protective mask, giving a wrong example to all others, especially taking into consideration that Mikhail Mishustin got sick with COVID-19 last April and even was hospitalized. Other LDPR deputies also actively participated in the joint fight against COVID-19 with concentration on the importance of preventive measures. LDPR fraction deputies made several initiatives and proposals to fight COVID-19 more effectively. Among LDPR fraction initiatives are a proposal to reserve a significant share of advertising spaces in the city center and for anti-pandemic campaign to provide school children and students with protective masks free of charge, and even to start a new school year 1 month later on October 1, 2020, to minimize the risk of pandemic among our children. Being a member of State Duma Committee on International Affairs, I advocate against premature opening of the international flight to resort areas. COVID-19 came to our country from abroad, and we should not forget about it. On August 11, 2020, Russia became the first country across the globe to register a vaccine against the coronavirus infection. The vaccine was developed by the Russian Health Ministry's Gamaleya National Research Center, underwent clinical trials in July. This great achievement of Russian medical science got full support from LDPR. Vladimir Zhirinovsky proposed to reward all people involved. Sputnik vaccine proved again that Russia is one of the highest medical powers. Western countries are trying to neglect our achievements because they were looking for monopoly in vaccine production that could bring billions of super profit for their pharmaceutical giants. Russia also took part of the international project to develop and distribute a vaccine against coronavirus in a new type, one of the founders of which is the World Health Organization. Moreover, the chairman of the Liberal Democratic Party of Russia, Vladimir Zhirinovsky, was among the first injected with the first in the world registered coronavirus vaccine. He also called to vaccinate all the party's 300,000 members as volunteers at the first test stage, and we will have started our registration for this forthcoming vaccination. Yes, our country had some achievements in that fight against COVID-19 pandemic. However, we could not rest until the threat could be eliminated completely. With reference to LDPR's chairman's opinion, ongoing pandemic revealed weak points and mistakes of Russia country healthcare policy system. Therefore, the coming parliamentary session should be fully concentrated on required corrective measures. We fully support the UN position that the COVID-19 pandemic is more than a health crisis. It is an economic crisis, a humanitarian crisis, a security crisis, and a human rights crisis as well. Coming out of this crisis will require a whole of society, whole of government, and whole of the world approach driven by compassion and solidarity. On September 11, 2020, the UN General Assembly adopted the resolution for a comprehensive and coordinated response to the COVID-19 pandemic, which became an important contribution to enhancing global solidarity and give more possibility for the international cooperation. Finally, no country in the world will be able to tackle COVID-19 on its own. The main strategy should be to act collectively so that nobody can be left behind. Thank you.